Hey everybody, Dentist Stanley here with Respiratory Sensei. Today we have something just a little bit nerdy for you, but if you're a respiratory therapist or a healthcare worker in the hospital at all, in the healthcare field, then you need to know about something called quality control, and sometimes called quality assurance and quality improvement. What the heck is that? And if you're taking the NBRC exam, you'll also need to know it. But like I said, it's a little bit nerdy, so probably just going to need to put on our nerdy glasses. All right, as the Japanese would say, 勉強しましょう. All right, the first thing we need to do is talk about some terms. And these are terms that you'll hear definitely on the NBRC exam from time to time, and definitely if you're working in the hospital. Every hospital, every healthcare organization has to focus on these things. It's actually a federal regulation. So you'll definitely hear about them, and you may also be a part of them. It's about managing quality of care in the hospital or the healthcare setting. And these are also things that you'll need to know a little bit for the NBRC exam. Of course, we'll focus on that. Now, I assume most of you are watching this because you're interested in the NBRC exam, but even if you're just a healthcare worker, a nurse, whoever, then you also may be interested in understanding a little bit about the quality endeavors that go on in your hospital. Now, I would be remiss if I didn't first talk about the terms that you might see, and that is quality control, quality assurance, and quality improvement. Now, these things are slightly different from one another. This video, in this part A, we're going to focus on first quality control, and this is the most important part for respiratory therapists, especially as it relates to the hospital setting and as it relates to the NBRC exam. But let me just describe to you what the differences of those things are first of all. When we talk about quality assurance, we're really talking about looking at a process that we do in healthcare that we want to keep the same way. And a quality assurance measure is really about discovering and checking out to see if we're doing things as we intend to do them in the first place. You know, if you're a respiratory therapist or a nurse or whatever, that mean that they're going to follow you in a procedure that you already know how to do. For an RT, for instance, it might be a blood gas. Maybe you've done 1,000 of those things. You definitely know how to do them. But the hospital or the organization may every once in a while decide to watch you. They may say, we need you to check off all of your procedures this year, so we're going to watch you do a blood gas. And you know how to do that, but what they're trying to do is just to make sure that they're assuring that the process and the procedure is being followed the same way each time. That's called quality assurance. It's not changing the process, it's just assuring that the quality is still there like you originally intend. Hey friends, hey, if you're liking this video and getting something out of the content on Respiratory Sensei, could you just do me a favor and press the subscribe button and the like button? Well, you know how it works. It just helps the YouTube algorithm and helps me to reach more people. Thanks for watching. Now, if you talk about quality improvement, that's different. Quality improvement is taking a process and changing it to improve patient care. This is where we might experiment with different processes to see if things work out better. In the respiratory therapy world, that might mean that you're going to exercise a new respiratory therapy-driven protocol for weaning patients off the ventilator. And that would help you to make changes on the ventilator without the doctor always writing the order. It might result, at least that's the supposition, in you getting the patient off quicker, giving better care, and that could amount to lower stay times in hospitals. So that would be improving care, and that would be quality assurance. But now, that's just a little bit of tidbit. What you really need to know for the NBRC exam especially is something called quality control. And this video, part A, is about quality control. All right, now I did say we're going to talk about quality control, and this is the most important part for the NBRC exam. We have some graphs to look at. We'll cover most of those in part B of this video, but let me jump back one more time and talk about quality improvement because there is something you need to know on the exam. Every once in a while, you're going to have to, on the NBRC exam, identify from a list of options what you think would be a good quality improvement program. Remember, that's when we're changing a process to see if it works out better, if it provides better care to the patient. And that's the key. The key to a good quality improvement program is one that is patient-centered. It results in good patient care or improved patient care. I say this because if you go into the average RT department in a lot of hospitals and say, hey, show me your quality improvement programs, they're going to show you something that really isn't patient quality improvement. but they're often there. So in other words, they might decide to track the number of therapists they have on staff that day compared to the number of treatments that were given. Well, that's really about workload, and that's really about department efficiency. And even though they may be tracking it, the hospital administration and managers may be super happy about that because they do care about the bottom line and the efficiency of the hospital. But if Joint Commission, who are the federal regulators, to come in and say, show me your quality improvement programs, if they saw that department efficiency study, they would say, that's nice, but that's not about patient care. So on the NBRC exam, anytime you're selecting a good quality improvement program, focus on that option that really is going to result in patient care. So as you might imagine, tracking the number of therapists on staff compared to the treatments given today or the number of ventilators that you had, that's more about efficiency and not about patient care. A good quality improvement program might be something that you track to see if you're doing better with the patient. So in other words, as I mentioned before, if you're doing a respiratory therapy driven protocol for weaning, that would be a good quality improvement program, because if you wean better and decrease the length of stay in the hospital and the patient gets to go home earlier and healthier, that's good quality improvement. Another more common one might be the number of missed therapy per day. So why did some therapy get missed today in the RT department? Well, maybe that's because when you went to give a treatment, the patient said, I want to eat my breakfast instead. Might have a timing problem with the therapy. Or it might be that you went there and the patient wasn't there because they were out for a procedure. Or it might be because you don't have enough staff online to get everybody there. In other words, there's just not a therapist to accomplish all the therapy. Well, all of those would definitely result in poor patient care or decreased patient care in terms of quality. And studying that, understanding that, and making some changes could result in improved patient care. So the key to quality improvement is to focus on patient care, not so much hospital or department efficiency. All right, now let's definitely focus on quality control. Quality control is a little bit different than quality assurance and quality improvement in that it focuses on specific data that you get from machines and from analyzers and from the lab. So it's about data. The reason why we care about making sure that we are getting good quality control in the data that we receive is that we're making decisions on that data. So the best thing I can talk to you about is an arterial blood gas machine. So as you know, you do arterial blood gases, and of course you get a result, and based upon that result, you make decisions. If the pH is really low and the CO2 is really high and they're in respiratory failure, then you might come out of the lab and realize you're not going to go to the patient. Rather, you're going to turn right to go get a ventilator and start preparing to intubate the patient. So you make serious decisions based upon that data. That's true with an SpO2 or other point-of-care information such as glucose monitoring and iStats or ABGs at bedside. All of these things produce data, and we act on the patient because of that data. Well, as you might imagine, we therefore have to assure or control the data and make sure and prove that the data coming out of those things is important. Now, for the NBRC exam, we need to focus on the arterial blood gas analyzer because the federal regulations require that that analyzer is proven at least twice a day. In other words, every shift, it could be every 8 to 12 hours, sometimes 3 times a day, that it is reporting accurate results. So to accomplish that, we have to inject what we call a fake blood material called a quality control material into the blood gas machine. Some blood gas machines have this cartridge built in. It's kind of automatic, and older ones, we used to have to inject it in there. But either way, it's a fake known material manufactured fake blood, basically. But that blood or that material has a known pH, PCO2, and PO2. And then when we go to analyze it, if the data that we get from the blood gas machine is not within the range that the manufacturer says that it should be, then we have a blood gas machine that's out of control. And that means we really shouldn't use it for patient testing, reporting, and certainly we shouldn't act upon that to do something different to the patient. So what we'll have to do, if it's in the machine automatically, if the machine detects it, it'll do 2 things. One, it'll flag itself as down. If it's an older machine, then you need to put a flag or a note on it that says, do not use this machine until you've done the repair. Typically, the repair is just required as just a 1-point or a 2-point calibration, Sometimes greater repair has to be done. Sometimes we have to call the manufacturer out to fix the machine so that when we do the quality control material, the values that we get are within the proper range, and we've proven once again that we can use it for patient testing. And that's really the basics of quality control. But in the next video, we're going to get a little bit more nerdy and start showing you how we keep track multiple times a day, whether it's every 8 hours or every 12 hours, how we keep track of the results of this quality control material. We graph it, we analyze it, and we look for certain trends, shifts, and patterns that should concern us. Now, this is something that when the federal regulators come into your hospital, they're going to want to see your ABG lab, and they're going to want to see this data to see how you're managing quality control. So we're going to cover that in part B of the next video.